Hello, John. We're going to discuss the results from the recent assessments that we administered to you. Just as an overview, you have come to us due to difficulties that you're having in your marriage. We wanted to measure the severity of any depression and anxiety symptoms that you may be experiencing. Also, we wanted to determine if you are experiencing any feelings of hopelessness or any suicidal ideation. We decided to administer 4 different tests to you. We used the Beck Depression Scale, the Beck Hopelessness Scale, the Beck Anxiety Inventory, and the Beck Scale for Suicide Ideation. On the Beck Anxiety Inventory, you scored an 18. This score falls into the moderate range. Your answers revealed that you tend to experience higher levels of anxiety in situations where you feel as if you have no control. Your physical symptoms then manifest into things such as trembling hands, an overall shaking of the body, or feeling as though your body is getting hot. All of these reactions and the anxiety that you're feeling can be attributed to the difficulties that you're having in your marriage. On the Beck Hopelessness Scale, you scored a 13. This score indicates that you are in the moderate to severe range. Reflecting on your responses and the pessimistic and optimistic statements that you gave, we gauge that you have an overall sentiment of displeasure in your current living situation, as you have an extremely poor outlook for the future. On the Beck Scale for Suicide Ideation, you scored a 2. Now, this assessment alone would tell me that I should have no real concerns over you having any thoughts of committing suicide. However, in conjunction with the Beck Depression Scale, we have great concerns for your propensity to self-harm. Now, on the Beck Depression Scale, you scored a 32. This indicates severe depression. You have feelings of irritability, feelings of isolation, and you have a loss of interest in things that you once felt pleasure from doing. What is of particular concern is that the assessment revealed that you were at an imminent risk for suicide, that you would kill yourself if given the chance. Now, John, I feel as though we should administer more questions from the Beck Scale for Suicide Ideation. I feel as though further examination is needed in this area, as you are experiencing severe levels of depressive symptomology. With further testing, we can gain better insight into the thought patterns that contribute to these thoughts of suicide that you're having. At this point, I just want to open the floor for discussion. I want to know your thoughts and feelings on the results from the test that we administered. If there's anything else you would like to talk about as far as the thoughts of suicide that you've been having, if you just want to elaborate, if you want to open the floor for discussion before we administer these tests, that would be great.